Good morning. I guess we're going to get started here. I'm not sure how many folks will have joining us today, but I wanted to make sure that we got all this content in here. My intention is that we will have most of this available on our cloud. And let me get here to my view. Hi, guys. And Andy, I'm glad to see you here. You always have the best questions. I had this all set up so that I would be in speaker mode, and that's not really wanting to do that. So we'll just go with it, right? So we'll roll with it. So I'm kind of choosing these different topics based on what the questions are that I get, and then also what seems to be the time of year that people need the most support with. So let's just kind of dive into it. This version of the video is going to be all about how to use your microsport, whether it's a home, whether it's a pro, whether it's rehab, for getting through injury and surgeries. And they're lumped together because the applications for healing are very, very similar. Whether you're dealing with like a higher level injury, this is probably not for your basic little kinds of things, but if you're trying to come back from a big injury, like a ankle sprain, a major sprain, a big fall, that kind of thing, it's very, very similar to coming out of surgery. So let's see. I'm having all kinds of technical issues today. So all of the units have a standard post-operative, post-injury section. It's called PO. That's what the PO stands for. That said, it's not just for post-operative or post-injury, but we're going to talk about the basics of those programs on their own, kind of like we did on the illness program. And then also we're going to talk about our clinical recommendations and how those have kind of evolved and what we're seeing now that we've got hundreds and thousands of people out there using it. So they're all placed together really just so that it would be really simple for people to have one area. If they're coming out of a surgery or they're coming off of a big injury, they're able to just kind of go to that section and go to kind of things. So however, obviously things like lymph detox support, nervous system reset, they all have multiple uses that you can use for. So let's dive into what those programs are. And so they're all kind of like right here on the home. This is the home version. This is the 2018 version. You can see our 8 little post-op programs there. On the Sport Pro, it's a similar color and actually not color, so a similar area of the unit intentionally, and they're exactly the same program. So if you're one of those practices that have multiple devices, the post-op section is exactly the same, regardless of whether you're working with your clinic unit or whether you're working with a home. So what's on there? So let's talk about that first. So post-op 1 and post-op 2, I'm going to lump them together because their purpose is really very similar. These programs were developed let me go here. Okay, so these programs were developed to have one set fast program so when I'm coming out of surgery and I have anesthesia brain, I don't need to really think through what I need to do. I just need to know that I run joint run first. And that's why it's named kind of simple, so that when you're in that kind of foggy state, it just kind of makes sense. This is the first one I run. Now, joint does also include spine. So if you're coming out of a spine surgery, it's PO1 that you're going to use, and that's because of the different types of tissues. The types of tissues that are kind of trying to heal or have been surgically altered are closer to the things that are normally done in joints than say the organ. The organ run first is a lot of step bleeding programs. That's the program you're going to run for say a gallbladder surgery or a colon surgery, a hysterectomy, those kinds of things. Nervous system reset is really literally the nervous system reset. For those people who might have traditional FSM training, there was a program called concussion. And one of our questions we get is like, is that concussion program? I'm like, well, it is our version of something in that system. I never cared for the term concussion protocol because people get confused and think that's what they should use for a concussion. And that's actually not focused on treating a brain injury. This is really about resetting the nervous system. That can be necessary for things like stress, like a lot of your work tension kinds of things. I always say nervous system reset, especially compared to stress nervous reset. They both have trauma focuses in the programs. They both have stress programs. They both have vagus programs. But the difference is that the organ run first. I'm sorry, the nervous system reset is more about like when stress becomes physical. So it has a bigger trauma component than say the stress nervous reset. The stress really is more for when you have that, when you're feeling so overwhelmed because it's because of stress. Also remember in that vein, if you're really in that category of feeling like you need maybe both of those to consider on that the trauma emotional severe, which is on the home units as well as on the Sport Pro. And detox support, I have to say, I think detox support is one of the programs I'm most proud of. And it just, to reiterate, it is not a detox program. It is not to make you detox. It is to support your body's organs of elimination. So that means like the liver, the kidney, the lymphatics. We do put a brief immune in there. And that's because as you clear out all of those systems, what it does is it can move those toxins that are in your system, and your body's working to get them out. And if there's anything infectious, we just kind of do a little bit of a boost. Not so much that you can't utilize the program if you say have an autoimmune disorder, but enough to make sure that we're kind of covered. The general swelling in lymph, I really put general swelling in this section because a lot of us practitioners know what the lymphatic system is, but a lot of our people, our end users, our non-practitioners are not going to understand what the lymphatics do. And it's an incredibly important system, which is why it's in this area. And it's also very critical to treating that from the get-go with surgeries to get that circulation, get that lymphatic flow. There is some of that built in already into PO1 and PO2. And so we'll talk a little bit more about that when we get to the actual program suggestions. Post-op constipation, anesthetic. You'll notice on the guidelines, we don't really advocate doing this for until really day 5 or so, because anesthesia post-operatively or post-injury is our friend. It is there to help us not realize how much damage has been done to our physical body. Right. And so we want to keep that in there. You can do this right after, that period of getting into the subacute phase of your recovery, but it also can be used as a detox when you're not in injury. So it does have a good dual purpose for that. Post-op constipation is typically used mostly in your recovery from surgeries or when you've had some other major anesthesia. What people don't realize, especially general anesthesia, does affect more specifically the parasympathetic nervous system. And that is the part of the nervous system that goes to the bowels, the bladder. That's why back in the day, you were not allowed to leave the hospital until you had a bowel movement and you went to the bathroom, so that they knew that those were working optimally. They're it's more refined these days, so they don't really feel like they have to keep you there just for that. But this program is actually really helpful in normalizing those systems. Post-op nerve. This is actually not a nerve pain program. I get people that think that. What this program is when people have nerve blocks, which is a very common type of anesthesia these days, there are times when that nerve does not come back at the same optimal level. And I even had an orthopedic surgeon one time I don't want to see, he was kind of laughingly, like, I don't think it was like laughter out of laughter. I think it was laughter out of uncomfortableness. He's like, yeah, sometimes they never come back. And so that's a real issue, and so it sounds great to really inject a local anesthesia into an area, but you want to make sure that we can bring back that nerve. And that's what this program is for. So I want to dive into, this is our clinical recs. And when these come in your manual, they also come as a PDF in that welcome email that we sent to you that has all those attachments. And this is one of those. So this is the injury protocol that was developed when we first started with How RT. This is the home version. I'm not going to go into both of those. The nice thing about these is it's meant to be very concise. It is a simple doc, so you can download it right onto your phone so that you have it like in your phone as you're at the hospital. I highly recommend that. That's why we give it to you as a PDF. And so, but I do want to kind of say, I want to walk through a few basics of this. I don't want to go into too much because I think most people will understand it. But I want to talk about where we're at now. For 2022, one of our big projects is to redo our manuals. And so you'll see them have a little bit more, a polished look. And Allison's been working hard to get everything kind of resized so that they fit better. They're more readable, and they'll all be kind of in that landscape format, so it makes more sense. So our typical, when we first started using HowRT, our PO1 and PO2, those two programs are kind of, they were written as a short version of trauma basics that also included pain. So my goal was to have it to be shorter so that it would be simple and that people would be more likely to utilize it. But I wanted something that had all those principles of trauma basics, which is stop bleeding, minimize bruising, reestablish circulation at a microvascular level, reestablish lymphatic flow, get that swelling out of there so that we could optimize the healing process. But obviously we need to have pain control early on and address that inflammatory response right away. And so that was what PO1 and PO2 were. Later in the slides, I talk about how they are the overachiever children of the HowRT. I never thought that they would be as effective as they are for pain control. So a lot of this post-operative day one was developed at a time when our expectation was get PO1 or PO2 on right away, use it right away, and then add in these other programs for whatever you need. So for joints and sprains, add injury to spine, use injury to, that's based on the home, that's the joint sprains program. For muscle, add in the muscle strain. What we found is that for day 1 and 2, and sometimes even into 3, most people report that PO, especially PO1, but also PO2, is all that they really need to manage their pain. And so that's kind of where we're shifting. And when we see the updates for the 2022 manuals, we'll actually show that and we'll modify this. So those other things will really just be if you're not maintaining the pain control or if we're not getting ahead of it in the way that we need to. So, and really, trauma basics has gotten to the point where we're just going to remove that as an optional because, and I like to see Andy's head nod when I say that, because really PO1 has been the go-to for really, and most people are saying, yeah, I just use PO1 for about 2 days, 2 to 3 days, and then add in maybe some joint swelling and things like that. So that's kind of our thought processes on that. Most people are not getting into having to do detox support or nervous system reset the first day. That's really only if people are feeling exceptionally stressed. The goal really for the first 1 to 3 days is all about pain control. Beyond that, it starts to get into more of the basics, and we'll talk about some of this stuff as well. So okay, so changes, PO1 and PO2 are the overachievers of the HowRT device. They are way beyond what my expectation were of just basic pain relief. They do seem to be very, very effective at reducing pain and also optimizing that there. I recommend for people to use this primarily for day 1 and day 2. And some people get such great results with it that they just keep going on to day 3. The goal with these is keep it on and keep it going, keep the current low so that you can be in there for the long haul. I don't see a lot of issues with detoxification for post-operative. I'm not sure why. I don't know if it's the nervous system just is focused on what it's working on and or that it's just not running frequencies that would cause a detox. So our goal is always pain control to 3 of 10 or less. So and we're going to talk about what that means if that is if you get higher than that. So when to add others. So really where we're kind of at right now is PO1 or PO2, PO1 for spine, or joint surgeries, any kind of like a jaw surgery, any kind of things like that. PO2 if it's a abdominal or organ based. The things that we typically see that need to be added, joint swelling, and that kind of makes sense, especially when you're dealing with things like ankles, maybe a hand, those extremities that are at the farthest end of the limb, right? They're going to be more likely to have the joint swelling. Bone pain, and that's typically when, especially if they've had to put screws in. For me, I'll use myself as a good example. Many of you know that because I had nothing better to do with my time, I decided to tear the tendons away from my ankle 2 years ago now. And I use my microcurrent exclusively for pain. I did not use any pain medications. I did get a harsh reality check that it is harder to have surgery after 50 than it is before. Just news flash. So I do feel for people that every decade is worse, right? So I have a feeling that if you have to have anything done after 60 or 70, it gets worse. But bone, it's funny because I could tell where they drilled into the side of my ankle bone. And it was the only time I really had a spike in pain. It was the middle of the night and it was a sharp shooting pain. And I just turned it to bone pain and it knocked it right down. And that was really the only time my pain ever went above a 3. So that's a common one. And then, fracture, also consider, if you have a fracture, typically, a lot of people, the bone can be very pain generating. The lining of the bone is highly innervated for pain, but many times it's also the spasm of the muscle. So if you break your leg in a football game, it is not just that bone that is injured. It's the muscles around it. It's the connective tissue. Sometimes it can be a nerve as well. The advantage of the night programs, so there's on the home, there's night 1, which is sprain and joint. And then also night 2 is fracture long. And so those programs can be run any time of the day. They're just meant to be longer programs that incorporate kind of everything. So like on the home unit, that's the one program that automatically adds in ligament. So if there's a really bad sprain, that's a good one to use. But if it's, say, a fracture, that night program helps with the swelling. It helps with the connective tissue components. It helps with the bone pain. It's all encompassing. And so it's a really easy go-to. It depends on your personality. There are some of our users that just love to be able to say, I know my leg is swollen, so I want to run joint swelling. I know I have bone pain, so I want to run. And if that's you, that's great. But I would say the vast majority of people are like, I just want to make it simple. I want to make it easy. I'll just put night fracture on and move along with my life, as they say. There's not a lot of moving along though at this phase. So you're on the couch. So what goes wrong? So we say, you're like, okay, Vanessa, I hear you saying my pain should be 3 or less, but what if it isn't? And so this is that section. So why is it not working enough? And I added enough because typically what I see is that it's always working. Like I've never actually seen anyone say that post-operative use of their microsport didn't work at all. It's when it's not working enough. 9 times out of 10, it's a nerve. And this is a intense pain. It can be a burning pain. You can have nerve symptoms like that, pins and needles, sharp shooting, all those kinds of typical nerve kinds of things. And there's a few reasons that I believe that this has occurred. I see a number of cases where there are actual nerve tractions that occur in surgery. Not really, people like, not really at the fault of the doctor. The tissues often are scarred and adhered in the area because there's been chronic inflammation. I see this a lot with spine surgeries. If you think about when people have spine surgery, it's often because they've lost the disc space in between the discs. And so they get scrunched. They're usually not like kind of aligned. They're usually kind of pie shaped. And so what the doctor has to do is he has to go in there and he has to bring it up. And so those scarred down adhered nerves that are in between those two disc bodies can often cause a little bit of a nerve traction injury. The key with it's all treatable. The key is just knowing to treat it, right? And so So there is, it could be that all of this was happened before the surgery. It could be that it's after. It doesn't matter. You're still going to treat it as if it's a new injury. And so nerve traction is obviously the best program for that. Sometimes there can be nerve damage where it's nicked. Those do become more difficult, and we do have to work harder to regenerate the nerve. And again, I'm not saying this to kind of have the doctor's back, but I am a physical therapist by trade, and I have not ever done surgery, but I have actually sat in on some surgeries, and I'm here to tell you that people's nerves do not all lie in the same place. So that doctor has no idea where that nerve actually is on you. And so I think sometimes I say that because if these things happen, then you have to kind of realize that what the doctor's looking at, and I don't want to say it's not his fault, because sometimes errors are made, but the vast majority of the times it's just because that nerve was in a place that they didn't expect it. If a nerve is completely cut, then it's cut, and there's typically not a way to regenerate that. But the reality is that most times they're not; they're just nicked, and it can often be healed. It's just going to take some time. And the same with compression. So compression is, usually because something's pressing on something. Usually with surgeries, they're going in and they're decompressing, and that helps that disc, it helps that spine area. But sometimes we do still have to treat that nerve. Nerve compression is the one program that is not on a home unit standard. And I've had some people ask me why, and I'm like, well, because if your nerve is compressed, you need to find out why. That's a structural issue that you need to take off whatever is pressing onto it, right? So all of these are treatable. You just need to know how to treat it. If it is determined that you have a nerve compression injury, you certainly should be first, reaching out and talking to me. I have a lot of background in treating nerve compressions. We have a great program from the Pro unit that can be placed on the units for nerve compression, and some different ways that we're kind of refining that. So I was actually pretty excited in the nerve compression area. We had a great group that uses our units with both NFL and NHL teams, and they had a pretty well-known nerve compression injury publicly, and they treated it in 3.5 weeks. And so nerve compression injuries are normally considered, well, in the back in the day before Howard T. Microsport, they were considered game over. Your career was over and you were going to have pain for the rest of your life. And now what we're finding is that they can treat these effectively, and that's really rewarding. And the nice thing is that with that group, they're a really good group, and they've become really super competent in the device. But they, really the only input I had was in the very beginning. I said, well, you'll need to run nerve compression program and run it a lot. I said it's a 3 to 4 week project on a 3 to 4 hour, but it was treatable. And that player is active and doing well today. All of these are treatable. You just need to know how to treat it. The other aspect that can flare up is bone pain, just like I had that in my ankle. You just have to know to treat it. It's just the bone pain program that's on all of our units. The other thing I put on here is could there be an oversensitized nervous system? I really haven't seen a lot of this, but but theoretically it could happen. And if that is the case, what I would say is if you really feel like you're that, I would say, oversensitized nervous system where everything feels like it bothers you, everything activates everything. Those are the clients I really say, consider using this stuff before you have to go into surgery. We don't always have that knowledge, but that is the best. That's the most ideal. With nervous system reset, treating probably the cord. And I do want to kind of throw that in there. If you know that you're prone to cord inflammation, whether that means that you've had a diagnosis of fibromyalgia or polymyalgia rheumatica, or you just are like me, where you're just like, I just know that when everything gets pissed off, and I probably have some inflammation in there. Treat those things before you go in, especially in the neck area. Because if nowadays they use less, they use more locals, they use more nerve blocks. But if they have to put you under general anesthesia, there's a lot of contortion that happens with your neck when they have to intubate you. And so you want to make sure that your neck is as healthy as possible so that we can avoid any problems there. Okay, so nerve options. What do you do if it is the nerve? The first thing I tell people is to figure out if it is the nerve. So I'm gonna throw my son's ex-girlfriend under the bus here. She had an ACL repair, and I actually was kind of, I kind of was alert and concerned because she told me that the doctor said he didn't have enough room in her knee, which I really am not really sure what that meant by that. But it was a red flag to me because I thought, well, if he didn't have room, then that tells me that he had to pull harder than he expected in the knee to do her ACL repair. And so what happened is she had a nerve traction injury, and a pretty bad one. And so the first thing we do is we figure out if it is. There's two programs that are on the home unit and on the Sport Pro, and those are quick nerve pain in the injury section. Yes. And Nerve Simple in the spine and nerve pain. Now, that's pre-22. In 2022, we actually made some changes. And so if you have a brand new device, you'll just use quick nerve pain. Either is fine. It's really just basic quick programs for us to see whether or not your pain responds to those nerve programs. It doesn't mean that it's going to take it from a 6 to a 0. But what I'm looking for is for it to go from like a 6 to say a 4, a 6 to a 3. Just a difference enough that we're like, yes, this is what we're dealing with the nerve. Once we know that we're dealing with a nerve, then we can look at nerve traction. That's the number one I recommend. You can go to Nerve Complete. You can use nerve compression on the Pro if you feel like it's indicated. It's not usually nerve compression. It's usually nerve traction or Nerve Complete. The reason, the other nice reason that I like nerve traction for this is many times these types of situations come because there was that pulling, because the nerve sheath was adhered. Nerve traction automatically treats for that. So it treats for traction nerves that have had injuries, and it has a brief period of bringing back that nerve, not as much as neuroatrophy, but a little bit. But I think it's really critical, that part that deals with scar tissue around that nerve sheath, because that's often part of the problem. If you know that you suspect that you have this going on, if you can use your device beforehand to create better tissue compliance, like more flexibility in that area, that would be the ideal. If you have like a Sport Pro unit or a rehab, there's a Neuroma nerve scar program, and that can be even used before the spine surgery to make sure that it's loosened up as much as we can beforehand. Other issues: compartment syndrome, CRPS, skin issues. Those are the big things I look for. Skin issues are probably honestly the bigger issue, and it has to do with we tell people you can use whatever electrodes that you want. We got into carrying the Cherished Life ones really just because of my own spine. When I had my ankle surgery, these are what I used because they're made out of sea kelp. But there are lots and lots of other electrodes out there, and you can use any electrode that has a pin style. Be careful in post-surgical, because you'll really want to place the pad on the area and then leave it. I left it on for literally 3 days until I got ready to take a shower, so that I'm not taking them on and off and creating that kind of irritation. Now, some electrodes may not be able to be used that long without creating skin irritation. And so that's something to really consider. And I would say do some due diligence and get the pads that work the best for you. That said, we have noticed MCAS. That's an issue where people have a histamine response, an overreaction of the immune system. And those clients often don't tolerate direct contact very well. So they have to limit how much they can do. Towels do seem to work better, but sometimes even they have issues with some of that. So work with us if you're one of those like kind of outlier systems. CRPS, it's really just about knowing to treat it. You're going to need to find somebody that has that specialized program, or literally get us your unit ASAP to get that on. That is a really adverse neurological condition that can just can occur after surgeries or injuries. It's not, there's nothing that happened that was wrong. It was just the way that your nervous system reacted. I often think that if we had maybe addressed some of the nervous system and calmed it down before we went in, would we have less of that reaction? But it is quite rare. Compartment syndrome, a lot of times compartment syndrome is when you have a major injury. It's usually in the lower extremities and the legs, and the tissues underneath expand and swell so much that they have to go in and actually make an incision in the skin so that it literally doesn't tear the skin apart. I think in the acute phase, muscle injury, muscle strain should knock that down enough. Trauma basics or PO1 should also knock that down so that you don't get into that situation. If you do, again, there's a specialized program for that. So pain over 3, I would say, you can rewatch this video. That's why we're doing this, is to kind of give you a framework to help guide you through your recovery process. But honestly, when you're in that space, you just need help, and you usually need it fast. So call us. If you call us on holidays or weekends, leave a message. Those messages actually get forwarded through an email to my personal cell phone. Email me directly. That's another direct way to get me. The way that we work, Vanessa at Howard T, and reaching me directly, I typically help with all the program supports and things like that. Post-operative and injury kind of care, Allison's going to defer right to me. If you need to order electrodes, new bags, whatever, Allison's your girl. I say I typically end up pushing you off to her anyway, because she does a better job at that. So just please remember that we're here to help you, and that we'll get you through that. So setups are the number one question, believe it or not, that I actually get on this stuff. And so let's talk about that real briefly, because it gets a little tricky when you're dealing with surgery. Typically, you all have been using your devices, red goes above and blue goes below. But a lot of times when you're dealing with surgery sites or an injury area, you really have to just do what you can do, right? And so the good thing is that on hands or lower extremities, they typically will leave some aspect of it open so that you can get stuff in there. So it sounds so hard. So when I broke my hand in 3 places, I guess it was probably almost 7 years ago now. They'll always it doesn't even matter. I had 3 fractures, so I had a cast on there. But they're always going to leave at least some space. And so what I recommend is that that's when the small 2x2s are nice. I just had one here just for this purpose. So you'll take that smaller, just cheat here. You'll take that smaller one and just put it wherever you can. Even if it's not on there, even if you have to kind of, wrap it around some of your extremities, you're not going to use the big 2x4s for somewhere like your fingertips or your toes. Get that on there. When I had my ankle stuff and my foot fracture, I just tucked it in there as far as I could, and I just left it. Right. And so it's okay for it to be spread across the open areas. It just has to make the contact. If it's not contacting, it's going to flash those red lights, and it's going to let you know that you need to work on that. So intensity, most of the programs and all of the programs that we're dealing in this realm are at 100. 100 is fine. I know some people like to have it higher. If you're sensitive to it, bring it down. But personally, in these kinds of things, low and slow is the way to go. I like that. Low and slow is the way to go, because you want to be able to keep that healing process going for days, right? So that you can really get yourself ahead of it. The key with all of these things is get ahead of the pain and then stay ahead of the pain. And a lot of times after that first week, even with pretty major surgeries, most people can transition to an as needed kind of thing. Now, if that said, if your goal is to, my goal is to be back on the Big Ten football field 4.5 weeks after my surgery for my broken leg, obviously you're going to keep going and you're going to keep that intensity going, even not usually during the day. Then it goes to longer night programs, and batching is really nice for that. So a couple words about, I know some of you guys have magnetic converters, the wellness PEMF magnetic converters. How this is how I utilize them, and we'll go from there. And this is it's newer technology, so it's a little bit still developing, but I don't see people tolerate these. This is a lot of high energy, and I don't see people when they first come out of surgery really tolerating that the energy flow, right? And so I am partial to microcurrent in the early phases of recovery because we know what our results are, and the results are very impressive, right? B, microcurrent, for those of you who have heard me lecture on resonance effect and modality effect. So modality effect is those things that are beneficial just because you're running that modality. And in this case, we're talking about running microcurrent, right? Microcurrent helps lay down tissue, helps lay down collagen and other important proteins that can help solidify the tissue and heal it. That's why it's used in traditional wound healing units. They are used, PEMF. Some people say, well, PEMF is also used for wound healing units. Yes, but I've never seen, now the sun's coming in here. I've never seen the same kinds of results with a PEMF device for, say, healing a wound. Not to say that there might not be some out there, but not at the same level as the microcurrent. So the microcurrent is tried and true when it comes to this. So I always say, just get the stickies on there. What else do you have to do? Really kind of make sure that you get them in. So say you have like a leg brace, you're going to actually just put those in there and kind of work them through the brace so that the brace or the clothes or your sock or like I had somebody who was doing it in her hand, and she used just a hair tie to hold the wires here at her wrist, right? So you just kind of use other clothing or tools to kind of keep it close to your body, and that way it makes it easier to use it and stay on. The one time I will say, if especially say you're a lower extremity leg kind of injury, and getting up and one of the biggest struggles is just getting up, like going to the bathroom, getting from room to room, like those first few days. That's a good time to maybe leave your wires where they are, but unhook them either at the electrode, so you'll just unplug it if it's easy enough, or if it snakes through things, that's when I actually will just take them out of here, just so that the last thing you'd want to do is drop your unit. There was a story one time with someone who dropped one in a toilet, and that will nuke it every time, and so I would never want that to be you. So hopefully that's so. Surgery preparation. We get this question a lot, and it's actually valid. I've mentioned on a couple occasions on things where you want to make sure things are prepped to go in to get the most out of your surgery. And I've had numerous surgeons that tell me clinically that they really loved how the patient's tissues were clean, right? They were wow, I've got like all kinds of sun coming in here. they were nice, clean margins, and they were able to get a better surgery because everything had been kind of taken care of. The key with this is to treat, but not over-treat. The goal is not to heal the tissues before you go into surgery. The goal is just to clean things up, calm things down so if he has to reattach, say, a tendon, that tendon is nice and clean. Doesn't have a bunch of inflammation and gunky stuff all around it. So the best way to do this is through Quick Sprains, that Quick Sprains joint pain program. It's in the injury section, quick joint / general pain. And the reason that we use that is that program, if people ask what the difference between the quick programs are and the others, is the quick focuses on inflammation and pain, but not on that healing process. They are meant to be very quick, down and dirty. I just want to throw something on really quick just so I can calm this down. But it also works really well for this kind of environment where I just want to calm down, take out the inflammation around that, say, tendon or ligament, and those are in there. I recommend treat 1 to 3 times in the 1 to 2 days prior to your issue to clean it up. That's it. So we're not treating, 2 or 3 times a day. We're not trying to heal anything. We're just trying to clean it up. Consider prepping your overall system with the detox support as well. I think going in there with a healthier liver, with a healthier lymphatic system is going to help you move things through your system more effectively. And again, keep in mind the goal is not to heal the tissues, it's to calm it down. I would actually, as we talk through this, I would also recommend, things like if you know that your nervous system is kind of jacked up anyway, like I tend to be that person that everything irritates it, or I tend to have nerve pain in general. Treat those first before you go in. So if you know that you have disc and nerve issues, run the spine disc injury. Use the nervous system reset or anxiety if that tends to be you, and use those things beforehand. You're still going to need them afterwards. I mean, going through surgery is I don't want to say a traumatic event, but it's a traumatic event, and so it's hard on your body. Your body knows it, and anyone who's kind of like knows you come out, you're kind of just kind of foggy and out of it, and that's that trauma effect. So expectations, the biggest expectation is keep the pain controlled, reduce or eliminate pain medications. We've had a Howard T out there for over 6 years now, and so I can kind of get to the point where I tell people most people don't need pain medications after most surgeries. Now that said, if you have a really like intricate back surgery where they're doing a lot of things, sometimes those people still do. I recommend, if that's the case, to really make sure that you focus on the cord. That's often the problem. And it might take more for that. A lot of times it's that scar tissue around the nerves that is the problem. Return to activity, so reduce or pain or eliminate pain meds. So most people are reporting back that they use 0 pain meds. For me personally, I never filled mine. I told my doctor I wasn't going to fill it. He said, okay, if you need to, there it is. I have to give it to you. You can do whatever you want. Get a good doctor who understands. For me personally, I had a doctor that does athletics, and mostly because those doctors tend to understand. They know FSM, and their response was, "Oh, I don't know your device, but I know FSM, and yeah, if you can get that kind of results, then I'm certainly open." There's a new openness to utilizing technologies like ours to use instead of pain medications, much more than I saw 10 years ago. When the pharmaceutical companies kind of had their way in the post-operative care. But yeah, you should be able to really reduce it at least. If you're not, contact me. Don't feel like you're bothering me. This is what I'm here for. The vast majority of you need very little help, and I never hear from you ever again. It makes me kind of lonely, but it's okay, because I know you're just out there healing yourselves, and that's the goal. So return to activity. Your return to activity is always going to be dependent upon what your doctor says. And there again, it's nice if you can find a doctor who at least is open to this technology. Return to activity is typically you're gonna be faster than you would without this. Now, how much faster? Many times it's not so much dependent upon how you look or how you feel, but what your doctor is going to tolerate. So we had, I know Andy, who's on here, knows this case, but we had a fun case this last fall where we got a football player back after a pretty significant leg fracture and surgery in 4.5 weeks. But truth be told, he was actually out on the field, I think around 3 weeks, 2.5 to 3 weeks. And that is kind of unheard of. But his surgeons were really supportive. They knew that he was using these technologies. And just so that you guys know, just completely transparent, we did not use just the microcurrent. That's where you can really super accelerate. The first week we did just microcurrent. Probably about day 5, we added in light LED as well as PEMF. And so he was using our combination of light magnet and current, and then he would use that. Sometimes we'd use it more specifically, like we would use the magnet for lymphatics because it works really great for circulation, and or joint swelling, and then use the micro for the tissue healing, like the fracture program. So it is somewhat dependent on the doctor. If I throw myself out there as an example, I did do therapy. My therapy was cut short because of COVID, like everything else, right? The day I got out of my boot was the day that they shut down all of my state, and so had no social life after that. But I was returned. The doctor had me cleared at 4.5 months when I was told it would be a 12-month, and that's actually pretty typical of what we find. If you look at our case of our broken leg, they did fixate it. But they had him on a treadmill within a week after his surgery, in an unweighted, he had a reduced weight mode. But that's so a fast rehab return. It depends on what your goals are. If your goals are to be healed as much as possible, for me personally, on my ankle, yes, I was cleared for return. My range of motion was good, but I actually didn't really loosen up my ankle for about 6 months. And my thought process behind that was, because I had torn away the connective tissue that held the tendons in place. I felt like at 50 plus years old, it was better for it to be overhealed than to be underhealed. And so it was more important to me to have stability as opposed to having 100% mobility. It might be a different decision based on what your expectations are. So, but yeah, get a great doctor who kind of understands what we're doing. If they're not and just open, let us know. We'll send them information. So this is our goal. This is our real goal. This picture cracks me up because I can't really see myself in my rehab process actually climbing a mountain. I'm not really. My PT brain says you shouldn't be doing that. But our goal is always to be your best you. And as long as you're doing that safely, or at least you're not going to hurt yourself so bad that you can't microsport your way out of it. And by all means, right, that's our goal. Our goal is to get you back and get you doing everything you want to do. So if you need changes, it's not a bad idea if you're going into surgery to contact me. We have a little girl who we see intermittently. She actually comes in from out of state, and she is having a procedure that would really benefit from a custom program put on there. And so we just plan ahead, right? And so we know that unit's going to be coming back. We know what we're going to put on there. We don't charge for changes, common changes to like the home unit mostly, because the Pro and Sport have everything on there you would ever need post-operatively. They're much more of a clinic-based type level unit. The home unit, if you're going to add any post-op, post-injury joint release, it's a program that I developed originally. If I'm really honest, I wrote it for NCAA softball players who need to get back super fast. And so we know that we don't want to run scar tissue frequencies, but my thought process was that if we can get it before a lot of scar tissue occurs, can we optimize the return back quickly without compromising the healing that we've been trying to generate? And that's what post-op, post-injury release is for. So it's about normalizing and getting better range of motion without undoing the healing that we need done. So that's a great one if you know that you're going into surgery to have put on there. However, that said, a lot of people don't realize that the 3 programs in the arthritis section, A3 is joint tendon, is for tendon stiffness. A4 is for joint stiffness. It's for joint stiffness. A8 is for stiff muscles and tissues. It's for the stiff muscles. Those programs can be used. They don't have scar tissue. They're very similar. They're not as short and concise as post-op injury, but they also can be used for that purpose. So We don't charge for any add-ons. We just, we ask for $45 for shipping only. I always say, don't change the standards. As soon as you do, you're going to want them. Just because it's early 2022 when I'm videoing this, I will kind of go over the few brief changes that we're making for the home. It's the first program changes we've made ever. And the basic things are, we're taking the night 4 spine, which is actually, that was placed on there as an alternate spine program. And it's an alternating program. It's for stenosis. So we feel like there's a lot of value to that. We actually moved it into the regular spine and nerve pain section. And so it takes the place of Nerve Simple. Nerve Simple is very, very basic, 40 and 396 for those that are programming. That's inflammation in the nerve. And so that has been kind of basically incorporated into the quick nerve. And so you won't really lose anything. We've also added in joint swelling in the arthritis. The arthritis joint swell, A5, is very similar to the joint swelling in the injury section. And so we've decided that it would be a better utilization of that space to add in the nerve pain diabetic. That program has really, it's been another overachiever. It not only does it help with the nerve regeneration of diabetes, but it also helps with difficult wounds. So it has a circulation component. It's nerve and circulation. And so that's really become kind of a really great program for difficult wounds that are not healing. So it's a good time to put that in there as well. We also took out Bone Spur Night because it's just a repeating version of the other Bone Spur program. And so that buys us actually an extra room, an extra space for add-ons. And how could I forget skin allergy and histamine, which actually, if you have skin irritation, is a good a good program to use in post-operatively. But it's been such a game changer for so many people, especially like our MCAS population. It is actually going to become a standard. There's going to be an I-13. So after lung asthma will be skin allergy and histamine. So I'm pretty sure those are all of them. So if you have to send it in for reprograms, those of you who have done it know that we're pretty quick. We want to know what programs you're going to change right off the bat. It's done in the programming. Your unit comes in, Allison takes that right out of the little box. As long as it's warm, as long as it's not cold, we won't program it if it's cold. We'll wait till it's room temperature. Just so you know, we're in Michigan. It is cold here a lot, and so not as cold as you, Andy, but it's darn cold. And so we make sure that it's warmed up to room temperature. We plug it in, and we typically will ship it back out the same day. And so we try to make it as quick as possible. So if you need to know someone that needs a unit, go through your existing practitioner. Some of you on here are that practitioner. If you need supports, we do have brochures. We have brochures that can actually have your name placed on a label behind them. We have some practitioners that we have a one-page sheet that can be customized with your information on it. We keep them in stock. We can ship same day during the business days. A lot of times we will even accommodate on weekends if possible. Overnight is available. It's just expensive, but it can be worth it, especially for post-surgical, kinds of care. The farthest overnight we ever had was to Hawaii, and it was for a surgery. One of our practitioners needed to have a surgery right away and did not want to do that without a Howe RT. So very soon, I am told by March 1st, online ordering will be available. So our practitioners will actually be able to go on there and order your units, pick out the programs that you want. You always still can call. We're always going to be available. And so that will make everything a lot more accessible. So here's our contact information. And it is still before noon. I think we started a couple minutes late, so we can go a little bit over. So those of you who are on with me, do you have any questions, Andy? Harold? No pressure.
I do.
I knew you would. That's why I love it when you're on, Andy.
Well, now I need to remember where I wrote it down. So give me a second. Oh, okay. So when you were talking towards the beginning about PO6, the toxin anesthesia.
Yes.
You said something new to me. Yay. Dual purpose. Certainly don't use it except for what, like 3 to 5 days after surgery. But then you said also it has another purpose. Can you repeat that? Because that was new to me.
Yeah, you can use it as a detox. So there are general toxin numbers in there as well as anesthesia. So it can be used as a general detox. So where detox support is all about supporting the organs of elimination, toxin anesthetic is about actually causing a detox reaction. Yeah.
Okay. Okay. Thank
And
you.
don't always think like, don't always think short term. Like, I had a personal case, and this was really interesting. He had constipation issues since he'd had a colon surgery. Like, I don't know, it's like 4 or 5 years before. I mean, a long time out. And it was running toxin anesthetic plus the post-op constipation. As a clinician, we always think it's funny. We always get the report back. I was in the bathroom for half a day, but then his problem resolved, right? And he had these like constipation, irregularity issues ever since his surgery. And what triggered it was the history, right? It's like it all happened when I had started after I'd had my surgery. Yeah.
Okay, thanks. The other thing, I guess I would just add, a couple of things came to mind when I read, the topic of your talk today, and a couple of things came to mind that I've learned. And one of them is not to get hung up on the program name. And the biggest one for me was we think whiplash and we think neck, and I'd only ever used it for neck. But then there was a situation, a back search situation, and you said try whiplash, and it was like going through a door to the next level. And I said, okay, I hadn't even considered that because of the name. So yeah, that was something that I learned.
I try to put some kind of hints in there in the manual, but at the same time, I try not to overwhelm people, because that's another reason to really not get away from trying to, I'll get people all the time, I'm a guy, I don't need the female issues. This was the very first one that I actually customized. And he called me literally like 8 months later and said, my mom's having a hysterectomy. What do I run? I'm like, that program that you took off that you said you would never need. And because what happens is a lot of these standards are put on there, for dual purpose. Acne is what I often recommend for a skin infection, right? Because acne is a minor staph infection of the skin. And so if you scratch your leg and you start to get a little area of redness, it's usually staph. That's the same kind of thing. So yeah, there's different things that can be used. I try not to overwhelm people with some of that. In general, I found that people are, it's more important for them to feel comfortable with it, rather than me throw out the thing that could happen 5 times out of a million. And it's easy for me to support, and that it's pretty easy for me to support and guide people through that, without as we build some of these, we will go into more of those different programs. My original intention was to have them be in-person courses where it would be more interactive. That just hasn't been able to happen here in Michigan with COVID. But we'll certainly get a lot of that information, and we'll start doing some pieces about the different devices or the different programs and what they do. I know for sure I want to do one for spine, and I know that you probably would have a lot to add in that, because there's so many different kinds of things. And I get that all the time, like, why are there 16 programs for spine pain? And I'm like, because there's just a bazillion different things that can go wrong with your spine. Right. So absolutely. Well, thank you, you guys. Any other questions, or are we good, Andy? Okay, so thanks everybody for coming, and this should be posted this afternoon if you want to revisit it, or send any of your clients to it. And we're kind of getting that down. Check out our new channel. I know we've got over a dozen on there already, and that'll all be tied into our new website. Super excited for you all to see that. The aesthetics are going to be a big step up, as well as the shopping cart aspects. So everybody have a great day. Stay warm. I know most of us here here are digging out in the Midwest, and probably out there too. So everybody have a great day. Stay healthy, and I hope you never need these programs.
Yeah. Thanks, Vanessa. See you.
Yeah, take care.